Hello, good morning, good afternoon, good evening, everyone. It's our great pleasure to welcome you to the online seminar hosted by the Global Health C Group of Design Research Society and the Brazilian Information Design Society on the health misinformation. I'm Cláudia Libânio, Associate Professor in the Federal University of Health Sciences in Brazil and convener of DRS Global Health C Group.
Hi everyone, I am Sara Goldchmit from the University of São Paulo in Brazil. I'm here representing the Health Special Interest Group of the Brazilian Information Design Society.
Hello, I am Thiago Barros Pontes e Silva, Associate Professor of the University of Brasília in Brazil. I'm also representing the Health Special Interest Group of the Brazilian Information Design Society.
So I would like to start thanking the Brazilian Information Design Society and the DRS for supporting the organization and communication of this event. I'm honored to introduce today's session, which brings together distinguished scholars and experts to address one of the most pressing challenges of our time. Misinformation in health represents a social threat that has the potential to undermine public health. The impact of inadequate information affects a wide spectrum of problems, such as a drop in vaccination rates, non-adherence to treatments for chronic diseases, beliefs in miracle cures for cancer, among others. Information design, on the other hand, aims to promote communicative efficiency and can change the narratives that negatively influence health decisions and give meaning to public health messages so they are relevant to individuals and communities. Today, we will explore this critical issue from two perspectives, including communication challenges in health, from user-centered design to food marketing and labeling. We are delighted to have with us two brilliant speakers, Professor Carla Espinillo from Federal University of Paraná in Brazil, that will examine misinformation, food marketing and labeling, and Professor Sue Walker from University of Reading in the UK. She will discuss how information design can help address communication challenges across different user groups.
So, this seminar is an opportunity not only to deepen our understanding of these pressing issues, but also to foster meaningful discussions and collaborations that can drive real change. Each speaker will have 25 minutes, and questions will be asked after the second speaker. Drop your questions in the chat. We will group them by similarity and present them for discussions with our panel. We encourage you to actively engage, share your insights, and pose questions to our speakers as we discuss this important topic together. Once again, thank you for joining us. We look forward to an enlightening and thought-provoking session. Now, I'd like to invite Professor Carla Espinillo to begin her presentation. Please, Carla.
Thank you. First of all, I'd like to thank you, the interest group on health of the Information Design Society in Brazil, for the invitation. Thank you then to Sara, Thiago, and Cláudia for the kind invitation. It's a challenge for me, and it's also a great pleasure to talk about, from experience and research experience, about a topic that is so dear to me, that's health and information design for health. So, I hope everything works perfectly. Let's see. My talk, before starting to talk to you about this information design and health misinformation, I'd like to thank people that made it possible for me. The team, we never work alone, so we work as a team. And I really would like to thank you, Carlos Rojas, maybe is here as well, Christopher Hammerschmidt, who have been working with me for 10 years, about 10 years on this topic that I'm going to tackle some special points. And without further ado, let's start with, hold on, here. misinformation and misinformation and disinformation. Well, they're quite similar, but actually they're quite different as well. Let's see. The World Health Organization, as Sara has commented, misinformation is one of the main threats to global health, mainly when we talk about health emergencies like pandemics. COVID-19 was one of them. And when we talk about misinformation, we have the experience of hate. We have the experience of associate COVID-19 to hate, to misunderstanding, to misinformation, and even to prejudice. So this slide shows the COVID-19 pandemic and 3 years of human rights watch on this. So it's not, we are talking something that regards individuals and collective and society and make people act in different ways, sometimes in ways that we don't want to think about, because misinformation is not only false information, but the dissemination of misinformation has no intention to cause harm. Generally comes from a person that may even believe that the misinformation is true, that kind of information is true. Whereas disinformation is a false information as well, and its dissemination has the intention to cause harm. There is a hidden agenda when we talk about disinformation. And we had the experience in our country, in Brazil, as well in the world, that sometimes misinformation, actually disinformation, elects presidents and promotes hate and even war. When we talk about misinformation and disinformation, we are talking about information gap, information void, ignorance and fear. And it happens when this is the ground for misinformation. And we have to watch when and how it's happening so we can be aware and how can we act towards this. And have this is all have to do with information behavior, human information behavior. We are talking about beliefs, we are talking about culture, and we are talking about literacy and mainly health literacy. And what information, misinformation, and disinformation led is an infodemic. It is interesting to point out that the World Health Organization actually is worried and very worried about infodemic. It's defined by them as an overflow of information of varying quality that surges across digital and physical environments during an acute public health event. The infodemic phenomenon is complex, extremely pervasive, and challenging to manage. Understand how it links to people's intent and behavior, online and offline, will be paramount to the future. Infodemics today is one of the major words of the World Health Organization. And they have even developed a course, an online course, to learn how to manage the infodemic and reduce its impact in the open WHU infodemic management courses. So it's so huge that the World Health Organization is trying to not only making people aware of it, but to empower people to deal with that at different levels. Infodemic affects people at multiple levels, as an individual or a family, a community, health systems, and society. And we had this in COVID-19 when we saw the impact in the health systems all over the world. Just to show you two very, very concerning issues in Brazil. We have about 9.1 million people in Brazil that are illiterate. And we also have that about in each 10 Brazilians are illiterate and mainly functional illiteracy. So we are talking people who are not able to read. We are talking people who are able to read but cannot understand. And when we talk about this, we actually are talking about people who cannot understand health information. So in Brazil, due to huge concern, the Ministry of Health has created a program called Health with Science, and it's intended to tackle issues of misinformation and disinformation. Just to have an idea, we have some health misinformation that we clarify with the Brazilian government in these programs. One of them is mammography is safe and helps in the early diagnosis of breast cancer. So people really are avoiding, some women are not taking mammography. They have fear of that. Vaccine against COVID-19 does not cause tumors. There is no planning for a new pandemic. Vaccines do not cause autism. So this, sometimes we can look at this and think, wow, how can people go and buy this sort of thoughts? This is because we are not prepared to inform people in the way they should understand. Not only we designers or we institution, but also the government. We need to think about in a broader way, in an individual way, as designers, as information designers, as institutions, and as government. Let's talk a bit about health washing that has to do with misinformation, mailing. So health washings make food and drinks appear healthier than they are. And this has been done by images and by typography. Cartoon and movie figures, realistic images and photographs. In the typography level, we have health claims that are not supported by products' nutrition values. So there is a deceptive marketing. And now it's getting bigger and bigger with the regulation that's trying to tackle these issues. I want to show you one example of using characters that are part of the children's word and repertoire to sell products that are not actually health enough. The appeal of image make the product look like they are healthy, they are fun, but they're not. And sometimes they're really rich that they can damage health. And here, just to have a look, the small bit for nutrition information. We have here the same appealing information with photographs and a small elements here that maybe you can see in this side, the information about the nutrition properties. Here is the localization of visual appeals on packaging regarding the other information. This is a part of a dissertation of former student of ours, Amanda Gomez, in 2020. And here you can see all the information regarding the appeals for children. Here is the nutrition and information. Here in yellow, the nutrition information. So you can see the difference, the imbalance between what is information about the food product, the drink product, and information to sell the product, the market information. And this is misleading, to say the least. And we have some research on the topic, health washings of ultra-processed products on Instagram, prevalence and strategy in an emerging market. So now this was published, I think this week. So it shows some other articles as well. Researchers in the nutrition field are really concerned about this topic. And now we have to be as well as information designers. But how can we know that we are being misinformed or disinformed when we are talking about food and food labeling? So we have the nutrition information as a way to see where or what's not healthy enough. The list of ingredients, the nutrition facts table. So legibility, visibility, and graphical configuration of a packaging can tell us what something is healthy or not? No, because the main point is to sell the product. But legibility, visibility, and graphic configurations has been used in a very not fair way, let's say so, to make the products appeal healthier. And let's see some of the information we have. How can we find information? How can we be prepared to judge if a product is healthy or not? If we can't read the nutrition information, if the nutrition information is not legible enough. This is one of the examples in the products in Brazil that you can really not see. And it's the level of legibility is really, really low. We have other situations as well when the product show images and the legibility of the nutritional information or the legibility of a regulatory information cannot be seen or is hidden. And here you have some elements that the letters was outlined that make it very difficult to read. Here you can't read it, but all the market information is clear, is readable, and is legible. Here's another example. I don't know if you can see very well, but we have here an attempt to make look legible when they try to put a clear background. But even though all the information that will be essential, the list of ingredients is here. And if you see the amount of space for marketing and the amount of space for, this is where the information is making available to the consumer. And this is, we can even wonder if we're talking here about misinformation or disinformation. The same here, where you have this information, very, very low legibility. However, all the market information is very legible. Here we can try to find, it's like, where is Wally? We are trying to find the information. You have to look for it, or you have to try hard to be able to read it. Here, the table, the nutrition table fact is hidden. And where should be written the expiring date actually is here. So legibility is related to the visual composition, the location, the position of the elements, and the marketing has been focused on images. Legibility has been poor because images, because the text is over images and texture backgrounds, because the packaging transparency, the letter outlines, small type sizes. Type size and the letter form is very difficult to read, and the minimum of line space, all in the regulatory information, as well as information about the quality, nutrition quality of the product. So let's talk now about nutrition labeling regulation, see how can it really help or not. So just to have an idea, this is one image of Christopher Hammersmith did this one. We have the front of packaging labeling in the Pan-American countries. We start here with Canada and the Brazilian solution and proposal for front of packaging labels based in Canada, unfortunately. And we have all the octagon as a front of packaging warning label. And we have here in Ecuador and Bolivia the use of the traffic light labeling based on UK labeling. What we have to talk about that is that if you look at this and say, oh, it's great, we have very, very good intentions of the government and regulations to make clear for the consumer when a product is not healthy in terms of the high amount of sugar, food fats, and sodium. But actually, the research has shown that some of these attempts and these signs showing in the front of packaging labeling, the high in of the products, we have some let's say misconceptions, or they look that they really work, but when we go for testing, they are not. For instance, I'd like to go back in 2017, when Brazil was trying to review the legislation and try to adopt a front of packaging labeling. And we have proposed, when I'm talking, is the Brazilian Institute for Consumer Rights, IDEC, and our university. We have proposed for a visa in Brazil, the high-in, auto-in, for 6 possibilities, and sodium, sugar, and others. And we did this proposal with a triangle, and we have the support of the society. We have 50,000 signatures supporting the proposal. We have a lot of TV and social media broadcasting our proposal. We have research doing verifying the effectiveness of the proposal. But after all that, this was not what happened in Brazil. And we have a very interesting point, that there's Brazilian Society Association, they found a document from the Brazilian Society of Industry and Food. They say that worst scenario for them, for the industry, would be the triangle as a warning sign for the Brazilian new regulation. And at the end, it was what happened was that it was not chosen as the Brazilian one, but let's go back a bit, but the magnifying lens. And let's see why. When we have tested, we found that 82% of people understand solubility of a product much more with the triangle than with the high in form a magnifying lens. We have also many researchers looking at the effectiveness of others front of package labeling. We have the GDA here, we have the traffic light, we have the octagon, and the researchers and all the studies show the positive effect of octagon over all the others, even the traffic lights system that it looks like that very effective, but actually it's not. And let's see, these are the research in Jamaica. Carlos Roja participated of this one. He's one of our team. And we have also in Brazil, looking at the influence of nutrition claims and different models of front of package labeling. And we saw the effectiveness of the octagon and triangle over the Brazilian regulation, in the Brazilian front of package labeling, the regulation. That's a magnifying lens. A magnifying lens is not a symbol for warning. Other studies have been conducted, lots of studies in Brazil in 10 years, and actually in the 2020 from 2020 to now. And just to make a point, that when the regulation pushed the industry to improve their products, Instead of that, sometimes they try to avoid and to develop strategies to make their way to marketing. So this is what happened now in Brazil. With the front of package labeling, adopted in 2020, the industry started to have sweeteners to avoid the FOP labeling of the magnifying lens. So we are now conducting research that we are looking at what would be the best way to inform the population in Brazil about this strategy. And sweeteners, there are lots of studies that relate sweeteners as disease and non-communicable disease and to health problems. So this strategy means that you think that you are eating or having a healthy food, and actually you are having sweeteners that may harm your health. And this strategy for marketing is really, really one point that Brazil is start to concern. And we are doing the research based on the strategy adopted in Argentina, that is using a warning for indicating this, what we call edulcorantes, the sweeteners in the food, so it go together with the magnifying lens. This study is undergoing. We are going to publish this. I think it was accepted for publication. I think very soon we will have to show it to you. So to end, I'd like to highlight the nutrition labeler is an information design system. We can't look at the nutrition labeling as a single label, as a single sign. It should be part of an information design system. And nutrition labeling is one of the main ways to fight health washing, because we can inform regulations through regulation for people with the credibility of a government. Not only was saying that's good or bad, but with the credibility of a government. When the Ministry of Health says it has high level of sodium, sugar, or other nutrients that is in excess, people will listen to. Well, to end, just to show you the proposal we are discussing to Mercosul, that's started 2023, and we proposed a system which is under discussion. And look, this is related to the nutrition facts table. And here you can see the applicability in some of the labels. So everything goes together. It makes it easier for the consumer to find information, to look at the information on nutrition as a system. They come together. They are easy to find, and they inform. They are from government to consumers in a way that is legible, findable, and credible. This is another possibility of presented information in products. Well, to end, I'd like just to say that now is the moment to act. Information designers, researchers, practitioners, and institutions like the Brazilian Society of Information Design and the Design Researchers Society. We have to take initiative to prevent and find health misinformation and health disinformation, because they are an information design matter. And because of that, information design matters. Thank you.
Thank you so much, Professor Carla Espinilo. Your presentation was highly pertinent and resonated strongly with our global context and Brazil. The issues you addressed are indeed of great relevance. Excellent. Thank you. Now we invite Professor Sue Walker to begin her presentation.
Hello, everyone. Thank you very much for inviting me to speak. My background is information design theory, practice, and history, and information design in relation to health and well-being has been the focus of my recent funded research, and it has been in antimicrobial resistance, diagnostic testing, and constipation in young people. Each of these has got a community focus. AMR in community pharmacies in the UK and in Rwanda. Instructions for point of use diagnostic tests that people carry out at home or in community clinics, and information about for parents who've got children that can't do a poo that's available in GP surgeries or further clinics. I don't want to go through each of these projects in detail, but rather draw examples from each to highlight some of the challenges of getting verbal and graphic messages across to people that need and will benefit from them, and particularly benefiting from easy to understand and accurate health messages. And appropriate messaging contributes to health literacy that in turn mitigates against health misinformation. And as all information designers know, there are those with messages to get across. They may be experts in their fields, clinicians, academics. They may have a certain amount of ego that they are the most highly knowledgeable person in the field. They may be working with constraints of time and resource, and they may not have a very clear idea of who the receivers of their information might be. Those intended to receive information may have different needs and backgrounds, even if one has, a relatively broad category, such as children or older people. Within those groups, there are lots of different needs and considerations to take account. And of course, there are different contexts of use. And good information design needs to understand all kinds of users that are involved in any communication situation. And the users need to know how information design methods might work. I mean, how do information designers go about getting the information they need? And there are well-known techniques for finding out. There are workshops, questionnaires, scenario workthroughs, and very important, I think, that working with as many kinds of users, whether they're providers or receivers of information, as you can, and at all points, as much iteration, backwards and forwards feedback is absolutely key. I'm going to talk a little bit now about some of the successful ways that we found of engaging with people. The next slide that I'd hoped to show you was a little film that I can provide a link later, but this was for a project about antimicrobial resistance in community pharmacies. And our approach to this was to set up a competition to attract teams, interdisciplinary teams that comprised a pharmacist, designer, an architect, because we were dealing with space, human factors, and so on. And we selected 5 teams to a 2 days exploration session. I won't go too much into that, but it worked very well. We had 2 competition winners that allowed us to produce prototypes for producing. We made prototypes to put into community pharmacies. One of them was a series of rotating cubes with different AMR stories that you had to turn the cubes to find out which one was which, with those at the bottom of the stack related to younger people than those at the top of the stack. Beat Bad Bugs was another campaign that involved stand-up figures, each with messages relevant to the particular person they were. Here we've got an older person, the pharmacists themselves. And this was complemented by leaflets and badges and so on and so forth. It worked very well as a method because we were involving so many people. We were working with pharmacists, we were working with pharmacists, and we were working with specialists in antimicrobial resistance. We carried out the same procedure in Rwanda, working with community pharmacies there, and the same methods worked well, working with visiting pharmacists, listening to everybody. The solutions were completely different because the context of use was different, and the main requirement in Rwanda was for people to have an antibiotic record card that recorded the kind of antibiotic that they got, because antibiotics aren't regulated in Rwanda in the way that they're regulated in the UK. So it was a very different context of use, but the way of working to find out that kind of information was very helpful. And the challenges that we faced were those that were sort of to do with research, really. How do you get money to Rwanda? The ethical issues of dealing with patients, people that were receiving antibiotics and so on. But I mean, those are the sorts of hassle that those of us that do research have to deal with all the time. A more serious challenge, I think, is when you don't get the kind of engagement that you need to be able to produce what you need to produce. And one of our projects was, oh, sorry, that slide just tells you where you can get more information about this. Sorry about that, missed those. We have a project working with our local hospital about constipation in young people. And this was with a group of clinicians at our local hospital, a consultant, a nurse practitioner. And we started with the idea of an ideas lab. Everybody very happy with that. Slightly different because it was in times of COVID, so we couldn't meet face to face. But the challenge was that the senior consultant liked the idea of an ideas lab because he assumed that it would be his ideas that would be taken forward. And meanwhile, as good information designers, my team were talking and listening to parents and nurse practitioners who had rather different ideas about how messages could be got across. And one of the challenges is that to get a solution is that it takes a long time. So we were exploring the idea of patient journeys, the length of time that it takes, talking with children, talking with nurse practitioners. These are very rough examples just to sort of fill the screen while I'm talking. But this approach took account of the needs of the children, the parents. It was developed very much in collaboration. The senior clinician didn't approve this approach at all. We had to withdraw from the project. His solution was to have a shot of himself, a screen with him talking, explaining everything, using his authority as a way of getting the message across, which was very disappointing to us, especially given the positive feedback we were getting from the other kinds of user. We then started, or round about the same time, we were working on instructions for diagnostic tests, spurred on by the very complicated instructions that some of the COVID rapid tests had with them. And we were concerned about this because we know that there's a lot of information design research about instructional text. We summarized a lot of this in what we called research briefings as part of the project that we were engaged with. And we felt that to be able to contribute something, we had to find something that was distinctive and new. And we realized that or we wanted to make a distinction between instructions for use that accompany every diagnostic test are different from instructions for use. And this is an example. If you look at point of care testing on this slide, if a patient's carrying out a test, rather than a test being carried out in a lab by professional people, patients or people that aren't clinicians need to know what to do. They need to take the sample, process it, and they need to be able to understand the results. And it was those processes and procedures that interested us, and we wanted to make people understand that there was a difference between instructions for use that do have, you know, pictures of the test and tell you what to do, but that information is sort of embedded within required legislation, with technical information, with formal things. And we wanted to make sure that there was a difference between that kind of thing, which is legally required, it has to be there, and instructions for use that people can understand. So we worked with a lot of people. We ran lots of tests, did different versions of things to come up with a system and approach to instructions for use. This is an example here of a rehash of a COVID lateral flow test that employs lots of techniques that information designers use all the time. So it's sort of dividing things into action steps and telling people what they should expect to find, and importantly, telling people what to do when they get a result. We then went on to try, this slide is some of the experimentation we did to find out different techniques. One of the things we were discussing and considering was the style of illustration. What you see here is what we call the sketchy style, and this was the style that was approved by people we were working with. It was the one they liked best because it had an air of formality. Some of our variants were more schematic, some of them were more detailed, but this was the version that or the style that people thought would be appropriate for this kind of thing. And we also looked at, or tried to get feedback about showing movement, whether it's better to have one hand or two hands, and whether we should show the hand in a schematic form or in a sketchy form, and so on and so forth. So small amounts, little bits of testing, not with very many people, and so on, contributed to our approach. And we produced a policy paper as part of a wider network called Pandemic and Beyond, that is making the point that instructions for use are different. Point of use instructions are different for instructions for use. We were then asked by Roche Diagnostics, they put us in touch with an area health authority to apply our instructions to a new test for flu. So we went through the process that most information designers would do. I think they had to go themselves, they had to look at the existing instructions, and we came up with an application of the same approach, the same design approach, by breaking down things into steps and differentiating the sections and so on. And this was our audience for these instructions were health professionals, they weren't for ordinary people, and that affected some of the information that we were able to include, or that we chose to include. And we also tested out applying our system to here we've got a quick guide and an internal quality control procedure. So there was a lot of positive feedback to this. We were talking with people, and we were asked if we would consider providing some instructions, some guidance for how to make point of use tests. And this resulted in what we informally call a toolkit. It's a word that's used quite a lot at the moment. And this toolkit sort of set out the kind of issues that we think that information designers and anyone producing a test should be aware of. It was particularly aimed at manufacturers of tests and designers who don't usually produce instructions. So it was written with those audiences in mind. And it sort of says some very basic things, which many of you will be familiar with. You know, get feedback at all stages, ask people what they think, and giving people example questions, and so on. We provided also examples of templates in InDesign that people could download, and examples of components and actions and so on that people could download and use as a starting point for their own illustrations. We wanted to try to make this useful. We were aware that it was aimed that we weren't considering a particular kind of user. We weren't particularly considering children or older people, but hopefully demonstrating through the sequence of events the kinds of things that people would have to do. We got some good feedback, and the comments on the left show this, a really good framework, blah, blah, blah. But I think the bottom one, if you're not telling people just what to do, you're trying to avoid key errors as well. And I think that was something that we thought was very important. We're trying to make things clear so that people, when they're taking a test themselves, don't make mistakes, because that can cause all sorts of issues and problems for those concerned. We have a website about this work, and our toolkit is open access, available for anybody that wants to have it. We're currently working with another company about a diagnostic test. I'm under a non-disclosure agreement, so I can't talk about it, and that's another challenge, because we've done some really interesting work. It's a very exciting test, but we can't talk about it yet. But I think it's an interesting area, and we have enjoyed working on it, and everything I've talked about has been very much the work of a team. It's not just my work, it's the work of a team. It's my team of researchers, but more importantly, I think the different kinds of user involved in each of these projects. Thank you.
Thank you so much for your brilliant presentation, Professor. It was really inspirational. And just a second. Bring everybody again. And we now have some time for questions and comments. Please feel free to use the YouTube chat if you're joining us online. And I see that we already have some, but I will start with a question for both of you. Then I start to try to manage all the other questions. And based on your experience, how can we foster a more strategic approach to information design in the public interest? I don't know who wants to start.
I think if I could start, just to say, I think it remains, I think, difficult for people to understand what information design does. I mean, I find with a number of projects that people interpret design as something that's done at the end of a project, and I think we have a task, a responsibility, if you like, to make sure that that information designers, design practitioners, design researchers get involved at the start of a project, so that they can really understand all the issues that are really important to good information design. Quite how one does that, I don't know.
Oh, well, taking what Sue said, is that how can we foster strategic approach? I think the first point is that to make us known. As Sue said, people do not know in general what we do as information designers, or because they think we do work at the end of the process, or because we are not involved with health information, or we are not really involved with social topics that are really relevant to society. So I think the first point is to make us known to people, to government, because we talk to ourselves, it's good, but it's not enough. If we want to make a difference, we want to really do something beneficial to society, we have to make us known. We have to go to conferences that are not only on design, to work with a multidisciplinary way with people in this case, with the health field. Not only the work that Sue is doing is open doors to design, information design research, is opening doors to people understand in Rwanda and in UK much more about what information design can do for people. Not only on projects, developing projects, but what is underneath. When we design a project, as Sue said and showed, is not only designing a project, but is it strategic thinking in a systematic way to get information to people through artifacts. So strategically, I think we have to develop policies in our institutions, because sometimes people in our university, they don't know what we do. They don't know what information designer is in our universities. So we have to be known. And I think the information design, Brazilian Information Design Society, and the Research Design Society and other societies are responsible as well to make it happen. Because I'm working 10 years in the health field, and Sue is working a lifetime in information design. And I work with information design since I was a student in Recife, and the situation didn't change much. We walked a lot, but I don't know how much we reached in our walking. So I'm glad to work with the Brazilian government, with PAHO, that we really make some progress in regard information design, but it is very, very, very small regarding everything we have been doing, and people don't know.
Thank you very much. I'll try to keep it the chronology of the chat. We already have some questions here. I have one from Camila. I guess it's for Carla as well. I guess this was about the slide, around your slide 34, when you had a map of the regulations. She's asking if this are the guidelines that regulate how information needs to be displayed on the food products.
Sorry,
the picture,
are the guidelines
Yeah.
to regulate how information needs to be displayed? Yes, there are regulations. In all the countries, we have regulations about how to display front of package labeling. We are now discussing in Brazil how to and the Mercosur how to display the other regulations, regulated information like expiring date, the amount of products in the packaging. But yes, they're regulated. The problem is that we are not participating in the process of regulation. So we have a nutrition and agencies with nutrition experts discussing information design, discussing legibility without understanding what legibility is actually. They are discussing where to place the information, and the people who are discussing with them around the world, generally from communication field and marketing. So market people discuss where the information should be placed. So it's like a conflict of interest. But anyway, we need to participate of this process because, yes, there are guidelines. And Christopher Hammerschmidt, my student, just did his Viva a month ago about how to evaluate the front of nutrition labeling in the table, nutrition table, and from an information design and legibility perspective. So we do not have designers, information designers, really working with regulation. Very, very few people. We in Brazil are lucky because we are working with this, with Anvisa, the Brazilian agencies, with PAHO, but there are a lot of things to be done in other countries. So I think we should really design an information design guidelines for this sort of regulations that involve legibility, involve graphic design, graphic configuration of information. So I think we should be together trying to design guidelines. The Pan American Health Organization just issued, I think last year, or maybe Carlos knows more than me, a booklet talking about how to evaluate front of package labeling. And they mention information design, they mention what is important. And we have some contribution to this material, but it's like one initiative. Just to have an idea, this course I just showed you on the how to fight and to manage infodemic, there is one lesson on user-centered design. And I'm sure no designer has participated. And there's a human-centered, user-centered design or human-centered design for infodemics management. And there is nothing about information design, and there is nothing about design. So if there is a gap, somebody somehow will fill in. If we don't do, somebody will do. So I think it's more than time that we start doing, filling the gaps.
Thank you very much. I won't keep the chronology as I promised, so I have a question for Professor Sue right now. It's from Karen. Thank you for joining us, Karen. She asks if the research briefs, she said that the briefs look very helpful, and she asks how do the instructions map onto the research briefs, or maybe they are not intended to be connected.
Yeah, the brief list relevant and summarize relevant information design papers that contribute to the way that we approach the design of instructions. So we haven't made any explicit links to what we use, but it was sort of background information that informed what we did, because we wanted to make sure we were following information design research, information design good practice, and not trying to replicate what had already been done. Is that
Thank you.
the right kind of answer? Yeah, but they're downloadable, those research briefings, if you want to have a look at them.
Thank you very much. I have another one from Carlos. Thank you, Carlos. He's asking Carla if you. He's saying he's like to expand on the effect of health claims and image appeals with the health warnings. What effects do this conflicting information have on consumers' understanding?
Thank you, Carlos. And I think you're the best person to answer your own question because you're researching on that. So it's true, and Carlos has published about that. When you have a front of package labeling, a warning labeling, and at the same time you have a claim that it's healthy, it's lots of vitamins, this will diminish the effect of the warning label, because people will start to, mainly if it's associated to a brand, if it's a brand that people trust and there is a label saying that's high in sugar or high in sodium, but it's very lots of vitamins and there are lots of healthy appeals, people will put it in the balance and will scale. So yes, if we don't have regulation about claims, were they in the images or in the text, if we don't start having regulations in Brazil, at least, to regulate the package when they have a high in nutrient in excess, they do not have to show claims that make people think it's healthy, because it's a health washing. And health washing, we know that is prevent people to buy healthy products. So the point is, yes, they influence a lot, and there are research about that. And also we have a marketing that influences a lot, and there is no regulation for marketing. So we have regulation for, say, it's high in sugar, it's high in nutrients in excess, but at the same time, we don't have regulation for visual appeals, for marketing appeal. So we can have movie characters, we can have sport characters, we can have lots of typographic appeals with very beautiful typefaces, and we have warnings. So it's a paradox. It's a visual paradox. So we have to go for pressure as a society, as information design society, a research design society, to have to pressure government and go together with a governmental organization to pressure the government for laws, for regulations. So they have to regulate marketing. They have to regulate, as they do with medicines. We have antibiotics being regulated in Brazil, as in Europe. We have regulated a lot of things, in the packaging of medicine. And why not in food and beverage? Because they are these two industries, in a sense, one benefit the other. So in a sense, yes, they do. So I believe that we should look at food and beverage packaging in a way that the government looks at medicine packaging and medicine information, because food is also something that make you healthier, like medicine if you're sick. So there are similarities in these two approaches and in these two industries as well. A lot of conflict of interest.
Keeping this subject, I think there's another question that may apply to both presentations. It's from Alana. Thank you, Alana. And she asks, how much emphasis has been placed on the responsibility of producers to influence consumers?
Sue, do you want to talk about that?
Well, I would just say in my work, I mean, I think a producer or a sort of person that's got information to get across, certainly manufacturers of diagnostic tests, who might be called a producer, they were very interested in the difference between instructions for use and point of use. They were very supportive. We worked with Roche Diagnostics, and they were very, very excited about this notion that you could actually make instructions that were easy to use. So I think in that particular case, these people we were working with did feel that they had some responsibility to try to make the test easy to use. And I mean, that raises all sorts of issues, because they still have to produce the instructions for use. So there's an added financial cost. And, you know, it's a small packet with a test. Is there space for another set of instructions to go in? There's all sorts of issues that need sorting out. But these particular people I was speaking with did want to take responsibility. They recognized the need to have an easy to use test.
Yeah, I think it is in this topic that Sue is bring about, is that in the pharmaceutical industry, when you inform people about medicine use, or technicians about how to conduct a test or something similar to that, to make information clear, it helps then to sell well that product. Because if people start not buying one medicine from a pharmaceutical industry and buy for another one, there is a competition. So making information clear, making information useful. Of course, there is a social way, there is a social aspect, but there is also a social economic impact, that you will sell well your product. Your medicine is clear to understand than the other one. So it's good for the patient, it's good for the industry. But when we are talking about food and beverage industry, it's a bit different, because you want to sell something that is tasty, something that is nice to eat, that is good to see in a nice package, that's something that is really sweet, even if sweet is not good for your health. So it's a difference, because when you talk about medicine, in this sense, when you talk about medicine, you're talking of people that needs a medicine to get well, it has a disease or a condition. When you talk about food, you talk about pleasure. And there is a different way of marketing medicines and marketing food. There are lots of similarities in the willing to sell, but there's a lot of different approach when you're doing the product itself. So in this sense, the industry, the food and beverage industry, they try to avoid regulation, in a sense that they try to, how can I go through the regulation, but to sell at the same time. So they try, and Carlos knows that, because we have a lot of images of products that try to, I forget the word in English, to go through the regulation terms of, okay, I will show the front of package labeling in my Easter egg, chocolate egg, but it will go together with the very beautiful thing that the ribbon. So it will go together with, I will put something nice typographically in the picture, so it goes together and it looks nice. So the idea of marketing is to try to avoid to have the front of package labeling, as well as to avoid the product to look not healthy or to look what it is. If you are honest and say what you're eating is not healthy, you won't sell. So in a sense, the market wants to make things look better than they are, and it's health washing. And this is what you're talking about. So the difference when we try to make information design in health field regarding to industrial pharmaceutical industry, there is a very, very nice way that we can do it, because it's nice for both. But when you go to the industry of food and beverage, we are sometimes going against them. And we are going in a way that we have to have the government supporting. We have to have the government say, yes, we want front of packaging label in Brazil. Yes, we want a front of packaging label, and that's a warning, not only a magnifying lens, because a magnifying lens is looking for things, and a warning is a warning. We are not looking for. We are seeing that, wow, it's danger. Pay attention. So we have to have government, and there's a lot of conflict of interest. And it's wonderful, it's challenging, and it's like, what can I say? Do advocacy in the field of food and beverage is wonderful and important, but we are all the time to be aware with the industry. And there's a lot of conflict of interest.
Thank you, Carla. I'll jump to a question from Alana. It connects to a question that I would like to ask as well. It's for Sue. She asks. She said that you mentioned testing designs with potential users.
Mm-hmm.
Are co-design and co-creation strategies used in these processes?
Well, the way that we worked, we sort of the co-design part was working with people to come up with options that we might test. So in relation to the style of the images in our instructions, for example, we were working with a manufacturer of a test, and they were sort of showing us examples, and they said, well, we'd like to know, whether it's better to have it schematic or whether we should have it sketchy. So the co-design was at that point, we did some alternatives and we worked with them, and they said, oh yes, that one, and that one. And then we tested the versions that we'd discussed together with a different set of people, with potential users of the test. And again, not very many people. I think we had 14 people in many of our tests that were just looking at the alternatives and saying, yeah, that one works better for us. So the testing is the sort of asking people what they think about something, and we did it in a very informal way. For some of our projects, we do more formal evaluation with larger groups of people, with testing that might involve people looking at two versions of things and answering questions about it. And then, that's done in a fairly systematic, controlled way, and the outcomes of any such tests would be quantitative, whereas the sort of smaller testing, hearing what people said was quite helpful, recording their comments, as well as finding that most of our 14 people liked a certain thing, but hearing what they said was also useful information. So it goes down to definition, really. What does co-design mean? What does co-creation mean? And what does testing mean? Because I think there are different ways of doing each of those things. And increasingly, co-design is used by people in other disciplines that don't know anything about what design is. I don't know if that's happening in Brazil as well, but it's certainly happening in this country. So I'm very sort of skeptical about the term co-design. Unless it really is the kind of co-design that would be led by people like us.
Thank you so much. Just to keep this subject, how can participatory design methodologies can be integrated into health communication efforts to ensure that the voices of the diverse communities are heard and addressed?
Well, my view, I mean, we found our sort of workshop approach worked really well in that kind of context, but to work well, I found that it's useful to construct teams of people that work together. So you're sort of anticipating who might want to be involved in that, who might have views, whether they're, in the case of the constipation project, we spoke with some children, we spoke with parents, we spoke with different kinds of parent, we spoke with single parents, with parents that were fostering children. So we were getting comments and voices from all different kinds of people that I would say were sort of participating in the process, and that's I think where I would use participatory design, in that we were gathering all the information that we needed from as many different kinds of team members that we possibly could. And again, it was a bit resource driven, because I've run a number of workshops, but it's always important, I think, to pay participants for their time. If people are giving up an hour or 2 or 3 of their time, then finding ways to reward them for that engagement, I think is really important, and can be quite challenging to find that resource.
Thank you. That was very insightful. I have another one from Carlos for Carla about literacy. He asks, how can information design help? Would it be something related to health education or as well as health promotion with plain language?
Yes, Carlos, both. I think the health literacy is related to both. Literacy in general, in a country like Brazil, as I showed, we have 9 million people illiterate. And when we go for functional illiteracy, it's higher. And if we go to health literacy, it's higher and higher, because literacy or functional literacy, we're talking about the ability of people to read, to be able to get a text and read and understand it. When we are talking about health literacy, we're talking about people who can read, but do not understand the health matters. So you're saying something like the components of food product, or we are talking how the possible disease or effects of a medicine that in the medicine insert, and people cannot understand what does it mean. So health literacy is something that is bigger and is beyond literacy itself. And in my view, the only way we can tackle this is if we start with education, going to schools and children and start talking about health literacy, about how to understand a leaflet, a medicine leaflet, how to understand how to use a medicine, how to understand how to conduct, to read a table of nutrition facts table, how to read a list of ingredients in a product. So these things are not easy to do, are tasks that will be necessary interventions in education. So if we have to start talking to people in the education field and the importance of having projects about education in schools, in universities, educations in hospital with patients. Sometimes the patient goes when they have to go home after a period in hospital. They have to take medicines. They have to do treatments. They don't know how to. So sometimes they get very difficult for them without the assistance of a professional, a health professional, when they get home to do all the procedures that should be done when you leave a hospital, or when you're preparing yourself for a treatment or exam. There you have to have a special diet or do not or take some medicines before prior exams, and you don't know how to do that. The doctor gives you a paper with all the information, but you can't understand not the language, but you can't understand what is the content, because it's a health content. So I believe the plain language is one way, but sometimes it's not enough. Because how can I explain what is sodium? It's not salt. It's different from salt. So high in sodium, what does it mean for a person? That if I say that soda is high in sodium and it's sweet and sodium is salt, how can I understand that? So I need people to know that the health literacy is part in language, so plain language will help, but not solve everything. But it's also the understanding of well-being. And this, the only way for me is education. It's the only way out.
Thank you so much. Our time is almost up, but we have a good one on the chat from Karen. And she asks if marketing departments have more power within organizations, how can information designers show their value within dynamic organizational ecosystems? What are persuasive arguments?
Wow. And then we talk about capitalism, and the argument is not persuasive enough. So we are dealing with organization, and the work Sue just showed us is very important, because she was working with government and organization, with the industry. And this organization, not talk about marketing departments, because I'm not talking about food, but the organization, the way the organization works towards information. When you work with an organization that is worried about the quality of information that you get across, so we can really do our job. But if you're working with organizations that not care about the quality of information, because they care with how can we sell that product. So we care about marketing. Our voice within the organization, there's no sound. They will not listen, because the organization will listen if they have an economic impact. When we talk about food and beverage industry, I showed you before the slide where the Association of Food Industry said that the worst scenario for them, for the Brazilian front of package labeling, would be the triangle. They said that not because they are worried about the best scenario for people get information, but it would be the worst scenario for us to sell our product. So talking with the organization will not be heard. You will not be heard. You have to talk with the society. We have to talk with the non-governmental organization. We have to talk to the government. This is where we are going to be heard, because this sort of quality of information that has to become with regulation. The food and food and drink industry, they will not change the quality, the health quality, and nutrition quality of their products if the government don't say you have to, or you will have a fine, or you will have a label that say high in. This is reality. This is what we are facing in Brazil now. We are discussing all over the world. And we have some strong evidence that what information design is possible to do to improve the quality of information. But it only will work if we will talk through society. This is why I said at the end of my talk that it's time for Brazilian Society of Information Design, for Design Research Society and others, and university to make pressure to change, to participate in the process. All governments, they do calls with the society to say, we are going to launch a new regulation. We want to hear the society. All democratic governments do that. We do it in Brazil. And then we have to look at these moments and participate and say, okay, the Brazilian Society of Information Design has a word to say about this and this. So in the European community, they have all the calls about all regulations. They're the same in US, the same in Canada. If they will heard us is another thing, but we have to talk. And the only way to talk is through the associations, through the organized society, not alone, and not within the organizations. I don't think it's a food industry will hear a design that say, you have to make your marketing smaller so I can put the nutrition table facts bigger. They won't listen to you.
Thank you. Professor Sue, would you like to add your thoughts about this issue before we close?
I've just got one thought. I think as information designers, if we can prove that presenting something in a clear and usable way will save a company money or time, it can be very convincing. And there's been a little bit of work of that kind. I can't just remember who's done some, but I think as information designers, maybe we have a responsibility to gather evidence that actually shows what a difference, whatever that might be, that good information design can make, and then have the confidence to go to these organizations and say, well, actually, look, here you are, boom, boom, boom. that might be one thing that I think we could do.
Thank you so much. Unfortunately, I believe our time is up. Before we close, I would like to sincerely thank our speakers for their insightful contributions, also the SBDI and the DRS for their support, and all of you in the audience for being here with us today. We truly appreciate your presence and interest. For those who couldn't attend or would like to revisit this discussion, this section will be available soon on the SBDI YouTube channel. With that, we bring this session to a close, and thank you, and see you next time.
Thank you.
Thank you. Thank you very much.
Thank you so much.
See you.